Okay, so what am I going to be talking about? Derivations? No. Experiments? Nope. That's all published, most of it first at this conference, by the way. So what's left? Well, people, places, events. I'm going to tell you the backstory, the inside story, the behind the scenes, the down low on 25-year effort to understand registration error that took place not just at Vanderbilt but other places too. Starring, and only a nerd can tell a story that stars TRE, FRE, and FLE. So the domain of this talk is rigid point registration. I think most of you know what that is, but just for the few that don't. So on the left we've got a CT, some kind of MR or some three-dimensional image, and we find some points that we can localize on there. Maybe we're using fiducials or maybe just anatomic features. And over here in the OR, and OR could be an image, but since this is IG-prim and there's, image guided and everything, so I'm going to be thinking about the OR. You find the same things over there in the OR, and then you find a rigid transformation that registers the first set of points to the second set of the points. And once you've done that, then you can look at other points like this point here, which we'll call a target, which is a non-fiducial point. These fiducials are faithful, that's the Latin. That means we believe them well enough that we can base our transformation on them. Then we can apply that transformation to other things, so we can find out where this hot spot that shows up in a T2 weighted MR image is in the OR and go after it. So it's a target in the sense that we're interested in it. Maybe we want to ablate it, maybe we want to avoid it. Maybe it's the facial nerve, for example. So you perform rigid point registration by rotating, translating, and getting these things to line up as best you can. Of course, they never line up perfectly because when we found them, we didn't find them perfectly because of fiducial localization error that's always present. Let me move that over to the middle there. Now, if you look where these two fiducials came together, they almost matched, but they didn't. We call that fiducial registration error, FRE. So we got two acronyms there. And there's the third one, target registration error. What we're really interested in is where did this registered blue point end up? Did it end up on the red one, the true position, or not? And of course, if the surgeon ablates the blue plus and he meant to hit the red one, well, that may be bad. Well, that's target registration error. We hope it's not too large. Well, what transformation do we use? How do we find it? We find the one transformation that minimizes, in the least squares sense, this FRE. So that's what everybody does, and that's the right thing to do, this least squares thing. To be specific, we find the rotation that we can apply to each blue point and the translation we can add to them to get them close to the red points. We square the error, and we try to minimize that. So why do you minimize the sum of squares? Instead of, say, the absolute values or the maximum, the median, the mean, something like that. That's a good question. I'm glad you thought of it. It shows you're paying attention. But let's answer another question first. Where did all this TRE, FRE, and FLE stuff come from in the first place? It's time for that backstory. It's time for you to sit back, relax, and enjoy the saga of AccuStar, truth stranger than fiction. There's a prologue, 1986. Dave Roberts' group at Dartmouth more or less invents frameless surgery, frameless guided surgery. They used fiducials, they had instrument tracking, they had computer displays, they had it all. They had a goal, target error of registration error of 1 millimeter. They didn't call it that then. But they got to 5 millimeters, which back in those days was quite a success story. Now let's go to 1 year later. The next step was to be taken at Vanderbilt. It would take 8 years. It would reach Robert's goal. It would be called AccuStar. Well, let's go back further. 1982. There's Vanderbilt in the middle of Tennessee. And here I come from the University of North Carolina. Steve Pizer was my mentor. I came to work on 2D registration problems in X-ray angiography. I had a Ph.D. in physics, a master's degree in computer science, big black hair, head of hair, and goggle glasses, as you can see. And I showed up there, and then 2 years later, a fellow named George Allen, M.D., came to take over neurosurgery at Vanderbilt. There was another arrival in 1984, right here. She would be named Catherine Lee Fitzpatrick, and that project occupied me for the next 3 years pretty seriously. Pat picked the name. I had to get rid of this car. Oh, it was so sweet. She vetoed my name. I thought Carmen Gia Fitzpatrick would be a perfect name for my daughter, but she didn't like that. Okay, so then 1 year later, in 1985, another fellow comes. His name is Bob Galloway. He's probably in the audience somewhere. Bob, where are you? So I can look for your face. There he is. He showed up from Duke, Ph.D. in biomedical engineering, to do a postdoc work in medical imaging. And in 1986, a fellow named Bob Masunas came from Mayo Clinic. He was a stereotactic neurosurgeon. He was different from this kind of neurosurgeon, although he wanted this guy here. Stereotactic neurosurgeons care about millimeters and Euclid geometry and that sort of stuff. Other surgeons don't give a hoot about that. And the reason George Allen wanted him is because George Allen had an idea he wanted to implement at Vanderbilt. And he put together this team that you see here to work on it. He got some money from Johnson & Johnson. 1 year funding, $157,000, kind of small. We started out with just 2 of us. Bob Galloway joined very soon after that, and eventually we have 50 people and 102 patients involved in this project. Johnson & Johnson reluctantly, we had to beg them to keep extending it year by year by year. We had to show them something all the time. Eventually, they spent $1.4 million at Vanderbilt. By today's NIH standards, that's pocket change, you know. But they spent $14 million total on this project. Here's the major players. You don't have to look at these names. I just want to give you a scope. This was a big project. These are the people at Vanderbilt. These are the people at Johnson & Johnson, a couple of CEOs of they call them CEOs, they're directors of divisions. NDI, David Crouch started out as CTO, became CEO. There were other names here, I don't have them. Then there was the major players at the other hospitals. We had 4 surgeons, in addition to Bob Masunas, that operated on patients for this project. Here's all the companies involved. SAIC is a big firm out in maybe in San Diego. They're out in the West Coast somewhere that does software. They rewrote all our graduate students' clunky software for the FDA. And this is what we would build. Everybody in this room is familiar with this idea. You got a tracked probe. Here's the tracker. It was a giant OptiTrack from Northern Digital. And the computer is running the show, and this shows you where you are. Well, let me look at this rendering here a little closer. This is a patient that we studied, and you see he's festooned with these markers all over his head. They're big and fat on the outside, and their little skinny legs go down into the skull to make them as minimally invasive as possible. A bigger marker makes for smaller localization error, so we knew we wanted them to be big. Well, before there was markers and infrared tracking and all that, there was stereotactic frames to do this, and there was Bob Galloway's arms. Oh, no, not those arms, these arms. His Mark I and Mark II arms, which were 6 degree of freedom, optically encoded localizers that could tell you where you are in the OR to a fraction of a millimeter. And we needed that because we wanted to be at that millimeter level. He and the other Bob used the Mark I and Mark II on over 50 patients. And that's important. They were pioneering something. They were among the pioneers doing this, but it was also important because they were convincing Johnson & Johnson to keep the funding going. And that was tough to do. These guys, you know, they would show up in their Learjet and their lizard skin shoes and their Rolex watches, and they'd look at what we were doing and say, what, these fellas down in the South, they don't know what. And so Bob Galloway would pull a cadaver head out of a bucket and throw it up there and put that arm on it and start moving it around, and Bob Masunas, and they'd go back a little shaky, and they'd say, maybe we should keep funding these guys. They're doing something serious down there. Well, meanwhile, in 1987 to 1982, other people were getting ahead of us. We had to go fast. People had an arm, they had fiducials, they had a computer display. In 87, a guy named Watanabe in Tokyo, he claimed 10 patients with 5 millimeters of accuracy. In Aachen over here, RWTH, 112 patients. And then we went to and they flew me around the country to check people out. They flew me to ISG Technologies in Toronto. They had clinical trials starting for FDA clearance of a commercial system, which really got Johnson & Johnson worried. I came back and I said, fellas, the Canadians are way ahead of us. We have got to get going. Well, in 1991, things changed. Northern Digital comes to Nashville. What happened was the project director at Johnson & Johnson decided he wanted to look at things other than arms. And he went up to Waterloo and he talked to these people. And he thought what they were doing might be the solution. So they came down into the neurosurgery conference room and they had a vision. They said, don't use the arm, replace it with this light little thing here, which will be tracked here. You know that part. Then we realized, they'd realized already, that this thing might get bumped. And once it's moved, then all bets are off. You find out where the fiducials are, and then somebody moves the camera, or the table moves. So then they offered this solution too, which, as far as I know, was an NDI original invention, although there's been a lot of patent disputes about that. They attached a reference emitter to the head, to the table, to the Mayfield, something to make that rigid. So if anything moved, you could know it, and we're in business. Once we saw that, we loved it. And Johnson & Johnson licensed it, and that was the beginning of Northern Digital getting into the medical field. And today, of course, they're the world standard. I think AccuStar had a little something to do with that. Plus, they're funding the poster presentation awards for this conference this year. So thank you very much, NDI. They're paying us back. So we had to design the markers, and this is what they look like. That's the ones you saw on that patient. That was in the image, and then we had this ball and socket affair we used in the OR so that when you found it in the image, you would be at the same point in the OR. Pretty basic, obvious idea. So once the markers were done, we froze the design. The software was written by SAIC. We're ready to go. Well, yeah, so we started our clinical trials. We're ready to start. We lost the race for the frameless system already. That went to Dartmouth. Maybe we could be the first to get FDA clearance. It's 1984. It's early. Well, in April, we lost that race because ISG's system in Toronto got FDA clearance that year, so that was over. Maybe we could be the first to be infrared. Okay, do that. Bob Galloway pointed this out to me. For years, I thought we were first at it. Turns out that in May, that was done at Wayne State using an optic track, for goodness sakes. So we lost that race too. Maybe we could be the first under the 1 millimeter hurdle. Okay, so finally, our clinical trial. We had 4 states, 4 hospitals, 5 surgeons, 102 patients. All the data was funneled back to this callow young graduate student. This $14 million project, all was impinging on him. And day after day, he was analyzing his results, thousands of things, notebooks full. He was signing everything, and he was thrilled to death. Number one, my graduate students were paid higher than other people's in those days, but that wasn't the main thing. This guy's dissertation was, he had all this data. Nobody else in the world had this data. So he was very happy. And it came in at under 1 millimeter, so we were so happy with that. What if it had come over 1 millimeter? There's just something magic about it being submillimetric. So we'd done it. We had the world's most accurate frameless system, and we could prove it. Johnson & Johnson paid a company $5,000 to come up with the name, AccuStar. If they'd have paid me $500, I could have done better than that. But anyway, it is what it is, and so that's what it was named. And December 11th, 1995, I'll never forget it, AccuStar was FDA cleared. The thing came through. The letter, 11 systems were ready for shipping. 6 of them are all shined up and boxed and heading toward the gate. The loading dock had 5 customers ready for their shipment. The helpline went live. Man, we were celebrating. 6 days later, folks, it was dead, and it never came back. AccuStar was killed November 17th, 1995, another day that will live in infamy. 6 days after it was cleared, and only a few hours before the first person was to take delivery on this thing. So who murdered AccuStar? And why? The murderer was Don Grilly. Who the heck is Don Grilly, and why did he kill AccuStar? Well, you know, when there's a murder mystery, you never can do better than to get the famous Belgian detective Hercule Poirot. So we get all the people in the room, and Hercule starts to talk, and he says, well, Don Grilly was the head of J&J's neurosurgery division. He had the power to do the killing. He had the weapon. What about motive? In the year before FDA clearance, neurosurgery merged with orthopedics, and Grilly became head of both of them. I had a mole in the company that gave me all this information, by the way. Grilly had inherited Accustar from another Johnson & Johnson executive, so he knew everybody would say, oh, you didn't really do this. He wouldn't get full credit for it. And orthopedics is bigger than neurosurgery, so it had the potential to contribute more to his bottom line, so he wanted to emphasize that. Which means, bonuses are definitely based on bottom lines. So he wanted it out of the way. So he decided to kill it. And he pulled the trigger, folks. It's 8 days before Christmas, 1995. You're a mean one, Mr. Grilly. So what was the collateral damage from this murder? Well, first of all, George Allen had a dream of the Allen marker. That went down. Johnson & Johnson, well, they lost $14 million. Of course, they're a multi-billion dollar, whatever. Don Grilly lost his job. Well, what about the winners? Bob Masunas parlayed this Accustar thing into becoming chair in neurosurgery at University of Rochester. Another fellow, we all like this guy a lot, the chair in neurosurgery at Washington. He became chair at UCSF. Bob Galloway, buku papers, citations, patents, full professorship. Same thing from me. Medtronic and Brain Lab, don't forget them. They marched right in with hundreds of millions of dollars in profit with no worries about Johnson & Johnson, who had just self-destructed. And graduate students. Bob's graduate students did well. I know more about mine. Here's mine. This was the first guy. He wrote the first 50,000-line code that SAIC redid. He's drinking a Sprite there. He is not a drinking man. Here he is today at RMS. They specialize in big error. They estimate errors for things like tsunamis and damage and stuff like that. Doing very well. Here's Calvin Maurer. A number of you know him with his 1,000-watt smile. He's still in the same business at VP. He's VP of research at Accuray in Sunnyvale. All these projects, all these dissertations had directly to do with this project. Here's Matt Wang. He married a woman who was getting a master's degree at the time. They had a son at the time when he graduated. And he's vice president of China Development Labs, head of Asian Pacific North Cluster Labs. He's head of 6,000 people now. I couldn't even get past his secretary if it were not for the coincidence that I happen to be his major professor. He's way up there compared to me now. By the way, William is his son's name, is scheduled to go to Vanderbilt this year. Jay West, a number of you know him. He's a denizen of this meeting very often. He's now Director of Advanced Product Engineering at Electa, San Francisco, wrote a very beautiful dissertation. There's something different about him, and I can't put my finger on it. So after our stalwart four were duly granted their well-deserved Ph.D s, they all went off into the world and found their fortunes, and they're living happily ever after. And that's the end of the saga of Accustar. So, back to the question we postponed. Why do we minimize the sum of squares errors? Well, in other words, why do we find these things to do that minimization, the R, and the rotation and translation? Well, it's really the answer to practically every question at this conference. It's a piece of advice I give to students. If you give a talk and then somebody strides to the microphone, they say, why is this the best solution to this problem? 2 words. Maximum likelihood. Just say maximum likelihood. And if the person doesn't know what you're talking about, they'll be impressed and you're taken care of. If they do know what you're talking about, they'll know you're probably right. Hidden in there somewhere is an optimization that's based on maximum likelihood. And if it's Harry Barrett, he will explain to you why you're right, make you feel good, and make a note of it. You can probably publish what he says next year. So anyway, the detailed answer is FLE is distributed normally, independently. If it looks like this, if each fiducial's error cloud is spherical and they're all the same size, then minimizing the mean squared FRE gives the transformation that has the maximum likelihood of being the true one. That's what it means. So that's why we do it. But when you do that, error always happens. Let's rewind to 1990. We knew enough way back then, that's the 25-year mark, to implement least squares fiducial registration error into our system. And that's when Venki Mandava was working on his dissertation when I started. But it was never zero, which proved that FLE was never zero, and that's about all we knew. We didn't have good definitions for these terms yet, good names. In fact, the whole registration business was a Tower of Babel if you were back in those days. People were using all those error descriptions there, and they were confused, same name meaning different things. We struggled with the terminology too in our papers and our communications dissertation. Here's this dissertation. He started working on that in 90, and I worked with him trying to help him with notation. We never used target registration error in that whole big book. But the next year we came to SPIE. Now, SPIE is first so much of the time in this talk. And we used target registration error 6 times in that paper. And we'd use the other terms in our previous version of it. I don't know why we got rid of those. 93, it all showed up in a paper that Calvin presented, all 3 terms. But we still hadn't published acronyms. You know, it's a small thing, but it's kind of interesting to note that they showed up in 95 and 96. TRE, FLE, and FRE. So we had these rational names, we had these cool acronyms, but we only had a vague notion of how they were related. And we hadn't convinced anybody else to use the terms. Well, we convinced them by a kind of accident. Every one of these AccuStar patients had a CT and a number of MRs, and every one of them you could find the markers in there, so you could do a very good job of registering them, less than a millimeter. And it was all the rage in those days to find out how to do the best retrospective transformation, no markers. Now, mutual information had not been published yet. People were just using surfaces and stuff, but they were moving in that direction. So we went to an NSF workshop and we talked around the table and said, what if we could provide you a set that you could do a blinded test on? We would airbrush out these markers, you could use them, send them to us, the transformations, and we'd tell you how close you came. People loved the idea. We had to airbrush these out. I lured Jay West at that time to come from Cambridge in the UK to work on his Ph.D. I had a little pot of money to support him. And I told him when he got there, your first chore is I want you to erase some markers. How many? He says. I said, well, there's just 305. Well, he did it. You can't just erase these things. You got to replace them with CT artifact under there and MR artifact. But he figured out how to mimic that and did that. Did a great job at it. So we got an NIH grant, thank goodness. Call it Retrospective Registration Evaluation. And we made TRE its centerpiece. There were 12 institutions in 4 countries signed up to do this, play ball with us. That was exciting. They all wanted to score small TREs. So now everybody's thinking TRE. And that began to spread it around. And Jay was their referee. They'd come in, they'd say, oh, we submitted the wrong thing. We need to change that. And he'd say, well, the deadline is passed or whatever. He was fair, but he was pretty firm. He did a good job, and he was in a tough spot. Nobody likes to referee. And he corralled all those people together, and he published an excellent paper, an award-winning paper with 31 co-authors. It won an award in Journal of Computer-Assisted Tomography. Of course, it showed up first here at SPIE. By June, there were a lot of people clamoring to be involved with this. We had 27 sites in 9 countries now. This thing was growing fast, so we knew we were a shoo-in for an NIH renewal. So we submitted the renewal, and 6 months later, the whole project was dead. The NIH didn't want to renew this. I mean, really, awards and worldwide confirmation, that's nice and all. But, I think the great Duke Ellington probably said it best when he said, roughly, it don't mean a thing if you ain't got that hypothesis. I've got a bully pulpit here. I'm going to take advantage of it for just a second or something, if you can. How could we come up with a hypothesis? We were trying to set something up so other people could test their hypothesis. Mutual information, normalized mutual information is better than hat and head or something like that. So maybe we were going for the wrong funding. We couldn't find any avenue that would work. And nowadays, if you're in engineering and somebody's reviewing your proposal, they'll come back and say, where's your hypothesis? You've got to have a scientific hypothesis. Well, engineering and science is a different thing. You're trying to make this gizmo do something that's never been done before. You got some goals, but it's not really a hypothesis. You don't need no stinking hypothesis. My hypothesis is, if you give me the money, I'll make this thing work. That's all the hypothesis I need. Okay, I'm off of that. But guess what? An amazing thing happened to that point. I hope he's in the room somewhere. He was here at the conference. Larry Clark, head of biomedical engineering at NCI, had become a fan of this project at SPIE. He'd seen our papers. He'd talked to us. He came on in his white steed with his shining armor and everything, and he slew the hypothesis dragon. He says, well, this is ridiculous. This thing needs to be funded. And he funded it under, he and Barbara Croft, she's on the, you probably can't see it from your angle, but she's on the back of that horse too. She was helping out with this, also at NIH. He funded it, they got it funded as an exception. Now, I was glad to get the money. I think that's, in NIH speak, that means, well, we fund nothing but great proposals. Well, there are the odd exceptions. But okay, I needed the money. I took the exception money. And Jay's paper has been cited over 500 times because of that. Thank you very much, Larry Clark. Well, we got the funding, such as it was, and the NIH rules required a new name, Retrospective Image Registration Evaluation. I made the name up, RIRE, which for some reason French speakers seem to think is funny. I don't understand that. But anyway, Jay graduated in 2001, and a new graduate student showed up. Ramya Balachandran, she was just as good as him at corralling people and keeping this thing going. The funding ran out in 2003, and we just continued it as a labor of love until 2005. I mean, we felt the same way as Larry Clark. This thing should be done, so we're just going to keep doing it. The folks, their love ran out. I mean, you know, we were so exhausted with shepherding these people through. It was not easy, and a lot of details and emails and signed documents and everything. We couldn't figure out how to automate it, so we announced at MICI 2005 it was ending on Halloween in that year. But then an amazing thing happened. Stephen Isleworth, Director of Operations at Kitware, comes in. He'd become a fan of this project, where else, at SPIE, and he slew the complexity dragon by porting the whole process over to Kitware's website. And now that thing has been used by 400 people all over the world. Thank you, Stephen. And here's what it looks like. It's like the Amazon of image registration. You can just click in there and it's just automatic. It takes care of you. Easy to do. You might want to try it sometime. And that was in 2007. So we have over 400 participants. You can see I've stopped putting pins on the map long ago, but that's more or less where the clusters are. We got every continent. We're still waiting for Antarctica. Okay, now on relating TRE, FRE, and FLE. Well, I worked on this hard. I tried to find some statistical formulas relating these things. I used up a ream of paper. I did half a sabbatical sitting there trying to come up with something. Failed. It just wouldn't work. I couldn't do it. And then, bless you, one day in 1995, I had an inspiration. I remember right where I was standing when this happened. This was so great. When I got working on my Ph.D. in physics, I had to do the quantum mechanics thing, you know, and so we solved these problems that were just totally intractable, but you could solve them to first order using perturbation theory. And I thought, well, FLE should be small, or nobody wants to use the system. Maybe we could come up with a first order approximation. So I told Jay and Calvin, let's try that. And we set to work on it. We worked for months, but man, it was tough. There was all these summations and subscripts and so many terms. It was painful. We were making progress, but it was really slow. And then we had a scare. I'm going to show you something very scary. You ready? There. That's Dave Hawkes. I thought Dave was coming to the meeting this year, but he wasn't able to make it. My good friend Dave Hawkes. In 1966, he came from a guy's hospital at London to visit our lab. He knew we were working on TRE formula. A lot of people knew we were trying to beat this thing down. Well, let me just show you what happened. So Dave shows up. He's got a briefcase. He shows up in the lab. He says, how are things going with TRE? I said, oh, man, we're having a tough time. He says, I think we've got it. And I think to myself, well, I can't tell you what I was really thinking. But what I said was, oh, great, that's good. So proud of you. Congratulations and everything like that. And then he reaches in the briefcase and a manuscript starts coming out. And I'm thinking, man, I don't want to see this thing. You know, if I learned something, my group was going to have to share authorship on this. We've worked so hard on this, it's just going to break our hearts. So I say, you know, Dave, if we were to find an error and correct it before you publish, your group would have to share authorship with our group. You realize that, right? And there's a pause, and that paper disappeared back into that briefcase. I was so glad. When he left, we got together with our graduate student, with my graduate students, and man, we redoubled our efforts. Everything moved off the table except that. And we got it. And I think we had MATLAB in those days, so instead of C++, so we could quickly check things back there with MATLAB, and it matched our simulations, and man, we were happy. Meanwhile, Dave went back to London, and they discovered there was a subtle mistake in there. So they stopped working on the problem. He showed me that manuscript years later, and I can tell you that while we were grinding our way through the math to try to get over to that wall over there, they just leaped over there and found the formula in just a brilliant insight. The trouble is, when you leap like that, sometimes you can leap over some steps that you really can't leave out, and they did miss something, and I'll show you what it was in a little bit. But I'm pretty sure that they hadn't quit, they'd have beat us. But they did, and we kept going, so that's good. So in November 1996, we submitted the formula to Image Processing and Medical Imaging. Now, some of you know about IPME. Maybe you don't. It's a tight-knit organization. There's like 100 people every time they have a meeting. Tough to get in. My major professor, my dear major professor, Steve Pizer, believed in it like almost religiously. It was a wonderful meeting. I wanted to get into this meeting again. I'd been there once. It's not easy. Well, I submitted this, and I wanted Steve to see me up there showing the world how we had solved this problem. And I was going to be so proud, and it was accepted, and oh, I was so excited. And then trouble. After it was accepted, one of the programming committee took another look at it and said this thing has to be withdrawn because, frankly, it had been published 7 years before. Oh. So we withdrew our paper from IPME. Oh, that hurt so bad. Well, we got around to going to the library, digging up the paper, and looked at it. What? It was no. He was wrong. It wasn't in this paper. We thought, well, maybe he gave us the wrong reference or something. We searched all the literature involved in that. It was a different area, and it was a strange notation and everything. No one had published it. We were excited, of course, but it was too late to get back into IPME. So I went to that IPME meeting, and I was miserable the whole time. Well, I got over that. A month later, I submitted it where I should have submitted it in the first place. It showed up at SPIE. We submitted it there, presented it at Newport Beach in 1998. And so SPIE was first. IPME was not. We got home from that conference, and of course we shined this thing up a little bit and sent it off to TMI because we wanted to get a journal publication. More trouble. 2 reviewers thought it was great. It was the dream review. Oh, this is pretty good, but you need to change this comma and you need to put this figure in a different. One guy hated everything about it. He said, number one, our formula would be obvious to anybody familiar with the problem. Now, I think Dave Hawkes over here in London would have been surprised to hear that one. Publishing our paper would actually be harmful to the unfortunates who happen to read it. He had this scheme about how it would be misleading to people or something. We couldn't understand it. Our paper should be rejected, and just make sure there's no chance for revision ever. This paper should never, ever go. But that's not the worst. The worst, stakes should be driven through the hearts. Okay, to be honest, he did not actually write that in there. But if you read between the lines, that was there too. But then an amazing thing happened. Well, you guessed it. We keep having these people save our bacon. Max, are you here? Because I thought I saw you. Yeah, there he is. All right, my hero. He wrote in. He was associate editor of this thing, and he just overruled the third reviewer, and TMI published the paper. Now I'm going to tell you something that I found out years later, just a couple of years ago. Riding on the back of that horse is Josine Plown, because Max asked Josine to look this paper over, and he trusted her opinion more than he trusted that reviewer's opinion. And that's why we got that paper published. Since then, that paper's been cited over 500 times. Thank you, Max. Appreciate that. Well, here's a little formula that caused all the fuss, not much to it. It just says that that's expected mean squared value of TRE is proportional to the same thing for FLE. That's not surprising. 1 over n, that's the number of markers. The more markers, the less error. That's not surprising. What's all this? I can even explain that to you. There's the fiducials. There's a target. You need to find the principal axes of these, and that's what the London group missed. Then you measured the distance to the first axis. That's D1. Second axis, D2, D3. Do that same thing for the fiducials. Measure all their distances to the axis. Take their RMS values. That's the Fs. And there's your formula. And you can look at it, and I'm not going to do it now, but you can take that formula and figure out where to put the markers, how to spread them out to get a good result. It's pretty handy to use. And a lot of people have used it. Many people have used it. Well, but that's just the RMS value. What about the distribution? If you want to know the 95%, you got to have a distribution. Well, in 1999, we sent the distribution to IPME. Well, IPME blew it before. We gave them another chance. And they blew it again. They accepted this paper, and they should have rejected it. Because we blew it. This paper was wrong. It was embarrassing. We found out after we were taking the poster down and the meeting was over, and we looked at it closely, that the thing was just wrong. We'd made a mistake. Well, we spent 2 years fixing that, finally got it right, sent it off to TMI, and it got published. You know, we should put a retraction. It's not easy. There's no retraction thing for these conferences. It's not an easy thing to do. I mean, we made a mistake. People make mistakes, but we needed to tell people that not to trust it. But anyway, 7 years later, Ramya got the FRE version of that, and there she is. Here she is today, assistant professor of otolaryngology, doing really quite well. That's her dissertation, on point based, as you can see, maybe. Okay, so one of the limitation is we're first order, remember? Well, anytime you hear somebody's done first order, you think maybe I'll try second order. Well, here was a second order solution. It was presented at MICI 2006. This shows the second order. But of course, when you show second order, you got to show, is it better than first order? I mean, that's why you do second order. Well, they showed the first order, and they named it, of course, Fitzpatrick algorithm, and boy, was it lousy. Well, they pointed out that you got to test in certain circumstances and everything, and I thought, oh, I guess when I did our MATLAB, we didn't check everything, and this is horrible now. We're so far off. Oh, my gosh. By the way, here's the algorithm. I had occasion to see the algorithm, our algorithm that they use. You notice anything funny about it? Notice anything strange? Anything funny right there? That's supposed to be a 3. They just had the 1 in there by accident. Of course, you fix it, then we look great. But, like I said, there's no way to publish, the follow-up, or that I know of. They made a mistake. I don't blame them. We make mistakes. But, these things are out there forever. You can't pull them back. There was another second-order solution. A guy named Saginer came out of the blue and went back into the blue, as far as I know. He made wrote a beautiful paper giving a second-order improvement. And let me show you what he did. Here's our formula. Here's his formula. Can you see the difference? See that on the back row? If you can, you're hallucinating. It's the same formula. Exactly the same. The twist is that he did something different with the fiducials. Well, let me show you what he did. So if you've got the blue fiducials and you register them to the red fiducials, here they are over here, kind of small. The white fiducials are the truth. You can't really see where they are. Nobody knows where they are. Our formula, we said use those true ones, but of course you can't. You use an approximation. The ones you've got, you use those. Oh, you can't see that. Let me blow that up for you a little bit. What's he doing here? That's the wrong. Let me go look at this one. Okay. If you look at the red and the blue, and you take the average, the purple one there. Saginer said, don't use the truth. Even if you know it, don't use it. Use this less accurate position of the fiducials to pump that into the formula, and guess what? You get a better answer. Is that amazing? He showed us that less accurate gives you more accurate, is what he said. Less accurate input gives you more accurate output. I think that's an amazing thing. But put it another way, he showed us that what we were already doing is what we should do, because everybody was doing that anyway. All you could do was take the average of those two because you didn't know the truth. But still, I think it's worth noting. Less is more, but not much more. Well, it looked like much more. Look at the difference between his and ours. But folks, look at the origin. Where is the origin? It's way... Well, let me plot the origin for you, too. Okay, so his error is here. So we're off by less than 1%. So I think first order is still pretty good. Okay, so there's the second order fix. What about homogeneity and isotropy? Remember, our formula requires that every TRE be derived from an FLE that's isotropic and homogeneous and all that sort of stuff. Well, those limitations began to fall away in 2007. Anisotropy means that FLE can vary with direction, so it'd be worse here than there. And inhomogeneity means that it can vary from one fiducial to the next. Maximum likelihood still works. You just got to find the covariances of each one of these, and you calculate a weighting function. It can be done very directly, and you do the solution to that. But then what does the error look like? Well, from 1998 to 2006, a whole lot of nothing was going on this. Nobody had solved any of these problems, no matter what kind of weight you used. And then all of a sudden, hold on to your seat, folks, fasten your seatbelt, because in 2007 and 2009, all of a sudden Ontario comes marching in and solves all these problems. Wiles, who's sitting right down there on the front row, glad to see you there. Andrew Wiles, leave of absence from NDI, working for Terry Peters over here. Burton Ma at Queens, and Mehdi Magari, the Purangs over here is his major professor somewhere in the room. They solved all these problems. They didn't do this one with the arbitrary weighting, but they took the ideal, the none, and everything, solved it all. I was fortunate to be chosen to be on the external review committee for both. I was the external reviewer for both of these dissertations. I got to pore over these things, and I'm telling you, folks, these were amazing, ingenious results that these people came up with. I had nothing to do with it. It was just remarkable. And the tenacity and the cleverness that was involved in these things has just got to be seen to be believed. But having seen that, I had a perspective. I realized that every one of these problems, you had to use a different formula, and it was sort of a Tower of Babelish type thing. Well, in 2010, one solution showed up that solved everything. The fellow's name was Balachandran. He published it first at SPIE. I know this person very well. I was his major professor. And here he is, then and now. Okay, it's the same picture. I mean, the guy hadn't changed that much in 4 years. He's now senior software engineer at Stryker Mako in Fort Lauderdale. And we're pretty proud to get back in the game, you know, kind of Vanderbilt showing up and dunking the ball at the last. I'm using the March Madness kind of analogy here. At the buzzer. Here's an embarrassing thing for all of us in this field. I'm going to show you the solution to all these problems. It's in MATLAB. That's it. 12 lines of MATLAB, 25 years of work. So does this mean we're a bunch of stoops? I mean, doing all this work and this is all you need? I don't think so. A lot of very, very complicated problems have relatively simple solutions when you finally get there. This is just moving the furniture around. The only real algorithm, only numerical stuff is a pseudo-inverse there, and there. And this, by the way, does TRE and FRE. So there we are, scoring at the buzzer, Vanderbilt, America. But you know what? To mix my metaphors from basketball to bridge, I think Andrew here had trumped everything, because all these formulas and algorithms are worthless if you don't know TLE. You got to find that out. How do you find that out? Well, you could wheel a big $1 million machine into the OR and have a perfect gold standard and compare to that, you know, localized with the two of them and compare. That'd be one way. Andrew, you showed us how to do this without a gold standard. And my hat is off to you. I never thought of this, and it works. We tried it at Vanderbilt. It works great. Published it in his dissertation, of course. So, is it time to turn out the lights and go home? I mean, we can predict FLE, we can predict TRE. I mean, we can measure FLE and predict TRE and FRE from it. So is everything solved? Was 25 years enough? Well, maybe not. Here's some problems that I suggest that somebody might want to look into. I'm not going to go over them. But the SPIE has decided to publish the slides from this talk, and this is being recorded, so you can look that up yourself if you want to. I think there's plenty of work to do. I think every single one of these, if you solved it, you could get a journal publication out of it. So that's it. That's our 25 years of error. So what do we get out of this story? Well, I got 3 points here. Reviewers, first of all. Reviewers are not gods, you young people. I'm one of them. We're just humans. We make mistakes. Don't let it get you down. And reviewers, a note to the reviewers themselves. You know, hubris is a dangerous thing. You gain nothing by humiliating the person that sent you the review, that sent you something to be reviewed. A little humility when you're reviewing goes a long way. SPIE. This is a great place to be. First of all, it's student-oriented. We put our students up here. We put their names on the paper first. And when we walk to the microphone and ask them a question, we're not going to pull our punches exactly, but you can ask me a mean question, but boy, we treat our students pretty well here. And we give them awards, and we have them mixed with the experts and that sort of stuff. So it's a good place to see something first, too, because a lot of people, what they've done, they figured out how to do a week before they got here, so you can be really up to date with SPIE. And there's lots of reviewers around here. The people that you impress may end up having an impact on you. Oh, and we've also got a new journal. This is really nice. I hope you know about this. Just started in April. This is SPIE Medical Imaging, the Journal of Medical Imaging. You can submit your SPIE paper to that journal. If it got in SPIE, you know it belongs in that journal. It may not have the quality, and it'll be carefully reviewed. And it's in the bylaws. We voted it in. It could be published as is. You don't have to change one single comma. There's nothing wrong with that. You're just going to a wider audience. And, of course, it's going to be reviewed more carefully. It'll probably get changed anyway. And maybe the best thing, mean time to publication from the time it comes to them and the time it shows up online for you to use in your next NIH proposal, 4 months. Okay, back to point 3, life. You know, life is like research. They both rely on trial and error. And there's plenty of error. There's been plenty of that in my life and in my research, as you have seen here. And sometimes it seems like nothing is going right and everything goes wrong. And when it does, it can be very depressing. But I'm telling you, go take a shower, watch a movie, go play golf, do whatever you want to do, take somebody out to dinner, wait a few days. You'll feel much better and get back in the game. The fact that you've had a tough time today, you've got critical reviews, and you've got setbacks does not mean you're not going to have success tomorrow. I know, that's you've seen. That's what happened to me over and over and over and over. And make a note of it. In your diary, in your journal, when you have these setbacks, write it down, because someday you'll be asked to stand up here and give a talk, and it can liven up your keynote. I just proved that too. Last thing, I've got to say thank you. I'm not going to name names, but I've been gathering pictures of people that impacted me in a good way over the years. These are graduate students. There are people at SPIE and people outside SPIE that helped me a whole lot. With the possible exception of one TMI reviewer and one head of a neurosurgery division, I'd like to thank all you people for helping me. And thank you for listening, and thank you for making it a great 25 years.